All right. Okay, I think we're live now. All right. Hello, everyone, and welcome to the very first episode of Connecting the Dots with Dr. Ashaye. My name is Lola Ashaye. I'm a primary care physician and owner of In Touch Primary Care in Sugar Land, Texas, and I am so excited you're here. So I didn't really promote this because it's my first one. But I'm sure you can go back and watch the video later. But this is the place to be if you're motivated to take charge of your health and make sure you're doing all that you can to live a healthy lifestyle. We're going to keep you informed, empowered, inspired, motivated, and give you tips on ways to achieve, improve, and maintain your health goals. We're going to feature guests as well, so stay tuned. So today we're going to be exploring this concept of preventing health conditions and how to connect the dots. But I'm going to tell you a story first. And this is a story that I remembered recently and has stuck with me throughout my career. So in 2008, I was in residency in Chicago, and I met a patient that had diabetes. She had been coming to the residency clinic for years, and she mentioned she saw one of our doctors 12 years ago who had predicted that she was going to be in the position she now found herself. So if nothing changed, and apparently nothing changed, and the position she now found herself was she was now on insulin. She was constantly in pain, and she just always expressed regret. Every time I saw her, she'll say something or the other about wishing she had listened, wishing things were different. She had heart disease, kidney disease, nerve disease, eye disease. She could barely see. She was in the hospital a lot. She was always seeing doctors, and her quality of life in general was poor. But it was too late to reverse the damage that had been done to her organs. So at this point, we're just doing the best we could, to prevent further damage. But what struck me most about her was I just always wondered, it was so easy to prevent this, like her A1C when she started off was not that bad. It was so easy to prevent all of these complications. And it bothered me that something so easy could become so complicated, within about 12 years. So now, she's pretty much just busy managing her conditions. She did not have an opportunity to really maximize her potential in her life, in her business, in anything, because she was just trying to stay alive at this point. The old adage says prevention is better than cure, and this was a definite reminder of this. So when I thought about her recently, I was just thinking about what were her barriers to care. Why she obviously had some knowledge that this was a problem, but I think her mindset about her health was definitely a big one. There was some denial. There was some lack of understanding about the nature of her condition. She probably didn't really believe that this was going to happen, or maybe she did and she was in denial. I don't know. I was speculating, but it just, obviously this shouldn't have happened. Now she was spending a lot more than she would have spent if she had taken care, if she had, addressed it sooner. So some of her barriers may have been cost of medication, cost of testing, cost of visits, maybe limited access to care. So I thought about also what could we as doctors have done differently? She'd been coming to that clinic for 12 years, but there were times when she wouldn't show for months or even years, like she'll disappear. But we didn't really have a system of following up. So if she came, she came. If she didn't, she didn't. So maybe if we did a better job with following up with her, was she able to make an appointment when she needed one? Could she come in easily and be seen? Could she have some of her questions answered? Was there an attempt to understand the barriers that she faced, or did we just label her as a non-compliant patient? I want to say that this never happened again, and I haven't seen it happen again, but that's not true. Unfortunately, this type of thing happens all the time. And over the years of practicing medicine, this is 15 years for me now, I've come to realize that preventing health conditions is a two-way street. It takes both the patient and the doctor. We have to be on the same page for it to work. It's a partnership, it's a relationship. The individual has to value their healthcare too. No matter what is said at the doctor's office, if there's no desire to change, it's going to be difficult. So the doctor can help with motivation, they can help with providing information, but at the end of the day, there has to be that desire from the patient as well. So that's part of what we're going to be talking about today. So now this doesn't have to be you, right? Because you've heard it, you can start today and make some changes. So there is not a magic wand, unfortunately. It's the good old stuff that still works, but I'm going to frame it differently, and hopefully I hope that will help with mindset, with some of the health conditions that you may have noticed. So the first one is healthy eating. So you may have heard food is medicine. Very true. What you eat is so, so important. And healthy eating gets scary to some people because they don't want to, they don't want to feel like they can't eat anything. And I don't like my patients feeling like that. The way I think about it is, what can you add? What can you add that is healthy today? Look around, what can you add to your meals to make it healthier? So don't focus on all the things you cannot eat. Start to focus on the things you can eat. Some vegetables maybe that you like. If you like some of them, then start buying them more often, especially the green ones, right? So buy more of the green stuff, the ones you can tolerate, instead of eating it once a month. Maybe eat it, start with once a week and then every day, okay? But think about what you can add, and that makes it a little bit easier. Can you add carrots? Can you add oranges? For those that don't have diabetes, can you add spinach? Can you add kale? Can you have a smoothie in the morning instead of, eggs and a lot of carbs? So you can see what you can add. And maybe you still have your eggs, but now you do one instead of three, because you're having a smoothie with it. So you added a smoothie. So that can be helpful if you think about it that way. And then add water too, right? So drinking 2 cups of water prior to your meal will make you feel full. That way you don't eat as much. And water is good for you anyway. So that's one way to do it. Start adding healthy options. The other thing is the good old exercise, I know. So exercise, you can start out very slowly, just 10 minutes of activity a day. Just start out with that. You can walk, you can dance, you can do something outside, inside, something to raise your heart rate for at least 10 minutes consistently. And then you can increase that over time, but it's better to just try something. Some people, would work really hard for 3 hours once a month. That doesn't work. It has to be consistent. You're better off actually just doing something very little consistently every day than doing something huge once in a while, right? So try to find something simple enough that you can start out with and just start doing it every day. Start today. There's never going to be a good time, so just go ahead and start. And then the third thing is sleeping. So sleep is not just to rest. Sleep actually helps heal your body. So you want to prioritize sleep, which means that you want to, sometimes what I do is I actually schedule an alarm to remind myself that it's almost time for bed. So I start to wind down, and then, by the time it's time for bed, I've done all my bedtime routine and I can go to bed. So that can be helpful for some people, but prioritizing sleep can be really helpful. So no matter where you are in your journey, the other thing that we should talk about is engaging. So these are just the tips I've given you and things you can start today. You can start right now, eating healthy, looking for the healthy options. You can start right away, the exercising, and you can start trying to prioritize your sleep today. Now, these other things will be how you can engage with your health, with your doctor, okay? And as I mentioned, it's a two-way street. It takes a patient making an effort to understand their health conditions, to take ownership of their care, to take it seriously, to get the best out of the healthcare system. So I'm going to recommend 3 things for that, okay? And what I'll say is, if you are following up with a doctor and you feel like the recommendations are not helping or you're not getting any better, seek another opinion, but don't just not do anything, okay? So here's how you can engage. Number 1, it's July, right? So that's almost half of the year gone. If you're due for your annual physical, please go get it done, okay? So your physical is important because that's where we screen for a lot of things. We screen for cancer, right? We screen for high blood pressure, for diabetes. That's where we screen for things, and screening means you don't have symptoms. So you could feel 100% fine, but if we don't check, if we don't screen, there might be something that you may have that we wouldn't know. So it's really important to go ahead and schedule your annual physical if you haven't already, okay? Even if you feel fine, okay? Number 2, don't ignore your symptoms. So there are some there's some things that may seem mild or may seem you may have had for a long time and you haven't addressed them. But sometimes those things are big things, and sometimes you can't tell the difference without doing more testing, okay? So it's important as much as possible to go ahead and address your symptoms. Even for, like, I have an example for a patient of mine that was coughing for a long time, and she didn't do any, and I've had this happen several times. She didn't get it addressed, and then weeks, or even I think it was like 4 to 6 weeks later, she calls and said, "Hey, by the way, I've been coughing," and turned out it was heartburn, and we treated it within a day or 2. Her symptoms resolved, and it was like all this time she was suffering needlessly. So it could even be stuff like that. But the point is, if there's a symptom, whether it's something simple or not, delaying care is not a good idea. You want to get it checked out sooner or later. And the last thing I'll say is follow up with one doctor consistently. You could have other doctors, specialists for different things, but you always want to come back to the one doctor. Why do I say that? And I believe strongly with one of the things that I'm concerned about now today is people go everywhere for healthcare. They go one day to one place, another day to another place, another day, and nobody is looking at the big picture. So that's how things get missed. The body is complex, and building a consistent relationship with your doctor helps your doctor put the pieces of the puzzle together, okay? And that takes time. Over time, we put one piece together, and that's how we're able to connect the dots. And that is the best way to prevent serious health conditions, by finding that one doctor you can follow up with to help you connect the dots. All right, so we've said a lot today, and I hope it's been helpful. If you are in the Houston area, we're in Sugarland suburb. If you're looking for a primary care doctor here, go ahead and contact us. We do the things differently here in Touch Primary Care. We spend time with you. Typically, your doctor spends, the average time is said to be 7 minutes. We spend 30 to 40 minutes, 30 to 1 hour, 30 minutes to 1 hour with you for your visits. Patients can contact us directly so that we address their concerns right away, so that their symptoms don't get worse. So the way we do things here is very different, and that's because we want to make sure that we help you achieve and maintain a healthy lifestyle. So we can work together, but remember, add healthy options, exercise, sleep, and then engage, make that physical appointment. Don't ignore your symptoms. Follow up with that one doctor consistently. And that's all I have for you this week. Please, if you found this helpful, go ahead and subscribe and share with somebody that might need it. And we'll be back next week, Wednesday at 2:15. Thank you. Bye-bye.